Okay, and we are on. Okay, please state your name, title, and company affiliation.
All right. Well, my name is Aman Quadri. I'm the CEO of AMSys Blockchain and Emerging Tech. I'm also the CEO of the AmChart Initiative, which is what we're talking about today. It's a electronic medical record platform that combines a mobile app with a personal health record to create collaboration between patients and providers.
Very cool. Can you talk a little bit about your background in blockchain and healthcare and how you've gotten to where you are today?
Sure. So I started in tech kind of in the dot-com days and then sold my company and decided to go into something in medicine, right? So I ended up going to physical therapy school. I have a DPT, so a doctor of physical therapy, and practiced for about 17 years, where I worked in conjunction with orthopedic surgeons, neurospecialists, chiropractors, and we all were involved in one holistic practice. And then we were bought out by a large organization, and they basically broke up the practice. And what we found is that when they added their level of technology to it, we actually lost productivity and lost our identity. And so the goal is how do we get back to giving ownership of data back to patients, but also to create that collaborative environment again, using tech, using new emerging tech to be able to get patients and providers back together.
So now getting into, for the book, what did you contribute and why was it important for you to bring up those topics?
Sure. So the case study that we're contributing is around experimentation with blockchain and emerging technologies, right? So as a rule, if you try to take a platform and want a company to try it out or to engage patients with it, it's really difficult in the US marketplace right now. So our goal was how do we go around that issue? So in the genius of our company's execs, they decided to buy and create a hospital in Mumbai, India. So now we've created a sandbox, if you will, that not only our technology can be tested out, but other healthcare blockchain companies can also come in and test out their initiatives and see what works, what doesn't work, refine it, and then bring it back to marketplaces that have a tougher sell.
Wow. Can you elaborate on why that was important for you to bring into the space, I guess?
Yeah. Well, the international market is really overlooked, for the most part, and so our goal was that a lot of the healthcare issues that we see in the U.S. are actually exploding in other nations, right? And so because our founders were from India, that's the place we chose to start, but also we felt like it's important for other companies that are doing things that we're not doing in aspects of emerging tech that need a place, that need that one place so they can explore what works. And so for us, it was a win-win, right? We not only provide social impact by helping the patients in our clinic, not only provide new technology interventions that could work throughout that country and beyond, but also for other healthcare companies who are limited on funds to be able to test and try out their product and then go to market.
Where do you think we are in terms of maturity for blockchain as a technology?
We're very similar to like my 15-month-old who's just learning to walk, who just kind of runs into walls every now and then, and really a lot of people are telling him no, right? That's kind of where we're at. Like, people don't understand what blockchain technology or AI or ML or any of these things mean, but what they're doing is when it gets mentioned, they go look it up, right? And then they come back with some questions, and then they want to learn a little bit more. So we've gone from waddling to now we'll start walking, I think, in the next 6 to 9 months, and then we'll start kind of jogging and seeing what comes out of it. So we're in our early stages, and so we've gone from theory to minor production, and so from minor production, now we need to go into full implementation.
So kind of branching off of that, what do you see as some of the most pressing issues that need to be solved in blockchain and healthcare?
Oh, there's like a whole horde of them, but I think some of the ones that we want to think about is how do we monitor patient identity and unique identifiers? How do we create really clean data that can be verified and trusted, that can be used for other purposes like clinical trial matching and AI engines and ML programs? We also want to think about how do we take blockchain initiatives and educate the masses about what the value prop is from that. So that's one of the biggest things that I see as a challenge.
So as we look forward to 2019 and beyond, what really excites you about blockchain in healthcare and what is to come?
Yeah, so one of the biggest exciting things for me is to see the amount of collaboration that's starting to occur. Companies are realizing that instead of staying in their siloed environments, now we can start working together and get to a solution faster, right? So if a company is doing credentialing, right? Credentialing is a great use case for it. I don't want to do it, but I can put them in our marketplace that we're building that allows other people to connect with them. I can look at something like a transparent marketplace pricing. Again, I'm not building it, but if all of us will connect to each other and allow patients to have choice and access, that's going to be the really cool thing that's coming up in the next, I think, 12 months or so.
Do you have, kind of in conclusion, any thoughts or comments that you'd like to leave readers with that are going to be picking up this book?
I think the biggest thing is don't be afraid of asking questions, and understand that a lot of the companies here that are part of this book or are exploring themselves, but there's going to be trials and failures. And through those failures, we hope that we can educate people on what worked and what didn't, so that if you decide to do an initiative, you can build on top of what we've done.
Awesome. Well, I have concluded my exhaustive list of questions.
Is that good?
So
it's all good.
If you have anything else you
No,
want to add.
I think that's pretty solid.
Fantastic, man. Thank you so much.
Man, I appreciate it.